There are many jobs in healthcare to choose from. Like most fields, there are different levels of care for what you can and can't do. In nursing, there are registered nurses who do medications and are more commonly recognized, and certified nurses assistants or CNAs who take care of the patient's activities of daily living. CNAs do the one-on-one care that an RN does not have the time to do. I have been a CNA for a year, and I would never trade my experience for any other job. It's hard, but well worth it. CNAs do a lot more than people give us credit for. We assist patients with personal care. We are the first to notice changes in the health of patients, and we play a large role in the patient's recovery. First, I'm going to talk about the personal care that CNAs provide for their patients. CNAs are known for wiping behinds, yes, but no, that is not all that we do. CNAs assist patients with getting ready for the day. At my work meeting the other day, I took a look at the updated task list for the CNAs on day shift. Some of the things that I saw on there were assisting with at least 60% of patients' baths and showers and linen changes. We must brush their teeth or dentures and give them oral care, keep rooms tidy and free of old linen and garbage, and so on. This adds up when there's little time, lots of calls, and 10 plus patients. It's busy, but these people need assistance with hygiene. CNAs pass trays and assist those who need help being fed. Also on my updated task list sheet for work, it reads, day shift is to pass and clean up breakfast, lunch, and dinner trays. Also, those who need to be fed have to wait until all the trays are passed. Then the CNA will go in the room and help their patient depending on their need. Some have dementia and need cueing. Some need reminders that their food is in front of them. Some can't use their hands, and some can't move at all and need total assistance. Patients we commonly feed are those who are confused and need constant cueing to the task at hand. Second, I'm going to talk about how CNAs are usually the ones to notice changes in a patient's health. CNAs take the patient's vitals. Vital signs include blood pressure, oxygen saturation, pulse, respirations, and temperatures. Vital signs are useful in detecting or monitoring medical problems. According to the Johns Hopkins website, high blood pressure or hypertension directly increases the risk of a heart attack, heart failure, and stroke. With high blood pressure, the arteries may have increased resistance against the flow of blood, causing the heart to pump harder to circulate the blood. Since CNAs are the ones taking the vitals, we have our attention directly on the patient, and we can notify the registered nurse because they won't see these changes in the patient. We can let them know if their numbers are off from the normal ranges in blood pressure or oxygen saturation, and they can notify the doctor. CNAs also see the patient's skin more often. According to Courtney L. Lynette and Elizabeth A. Ayalo's handbook, pressure ulcers, a patient safety issue. Pressure ulcers remain a major health problem affecting approximately 3 million adults. In 1993, pressure ulcers were noted in 280,000 hospital stays, and 11 years later, the number of ulcers was 455,000. CNAs must turn these patients who are at risk for bed sores every 2 hours at a minimum, while checking their bottoms, heels, elbows, and back each turn. Lastly, I'm going to finish up with how CNAs play a role in the patient's recovery physically and emotionally. CNAs play a role in the patient's recovery physically. On the floor that I work on, surgical care unit, we help patients get up for the first time after their surgery. We help them when they're unsteady. We evaluate how safe they are transferring and what they can physically do on their own. I did a small interview with one of our physical therapists who asked not to be named but agreed for me to use their quote for a source. A lot of times patients are very weak and require more than half assistance to get in and out of bed, in and out of a chair, on and off a toilet or bedside commode. We give tips and assist patients with physical things until they can learn or get their strength back. CNAs also play a role in patients' recovery emotionally. According to Deborah Stinson in her article, What is the Importance of Emotional Support to a Patient? Moreover, as a nursing assistant, you should take some time to have a little chat with your patients who don't have any friends or family or any other visitor, as you might be the only person that interacts with the patient. I've had many patients with little to no support system, and it really drags them down when it comes to their recovery. Friends and family make a whole lot of a difference, but I love that we can at least be there to be their support system. All in all, CNAs have a tough job. We are spread thin beyond measures and overworked. The hours can be long, and we don't have the best reputation, but CNAs have a much larger role in healthcare than people give us credit for. CNAs provide primary care. They notice changes in the health of their patients, and they assist in patient recovery. I wouldn't trade my experience for anything.